a reminder for all of us that this is, oh, we're live now. Okay, cool. Just a reminder that you guys can feel free to jump in wherever if you have any follow-up, that kind of thing. But yeah, we're recording. We'll start in a few minutes for everyone. Probably start around 12, yeah, 12:01 maybe, just to give time for people to log on. Hello, everyone. We're just waiting a few minutes before as people get logged on here. And so hopefully you guys can now see my screen. Is that right?
Yep.
Great. All right, so I think we can get started now. Good morning and good afternoon, everyone. Thank you for joining the American Indian Cancer Foundation's first Indigenous Pink webinar of the month. It is titled Nutrition, Food Access, and Cancer Survivorship. So we are hosting this webinar in partnership with the Intertribal Council of Michigan Incorporated, and we are grateful to have you all here. So today we'll be discussing the influence that nutrition and food access have along the cancer continuum. Before we get started, I want to let the audience know that we love questions, so please feel free to type a question into the chat. I'll do my best to go through them throughout the presentation. Sometimes I cannot see the Q&A box for some reason, so I encourage you to use the chat box. Again, thank you all for joining us. My name is Misha Leffler, and I'm the Cancer Equity Coordinator for the American Indian Cancer Foundation. I will be doing some of the moderating today. Today's discussion or webinar is going to be a roundtable discussion with time for each panelist to discuss, which brings me to our presenters. So I'm so grateful and excited to announce our presenters. We have Beth Seeloff and Sarah Keller from the Intertribal Council of Michigan and Dr. Michelle Heiser from Roswell Park. Now I would love it if you guys would please introduce yourselves.
Hi, I'm Beth Seeloff, and I'm a cancer prevention and control specialist with the Intertribal Council of Michigan, and we serve both nationally and state federally recognized tribes and Native Americans populations across the United States.
I'm Sarah Keller. I also work with the Intertribal Council of Michigan on our young breast cancer programs, and I run Quay Brave, which I'll talk about later.
Yat A Shay Michelle Heiser Yanishya Ashihi Nishla Dutch A Bashchi Dutch Deshanale Sena Habitni Dushache. Hi everyone, I'm Michelle Heiser. I'm a surgery oncology fellow here at Roswell Park in Buffalo, New York. I originally grew up in Winter Rock, Arizona, so I'm happy to be here and hopefully can be a part of this interesting conversation.
Thank you all. So for those that don't know, ACAF is a national nonprofit organization established to address tremendous cancer inequities faced by American Indians and Alaska Natives. Our mission is to eliminate cancer burdens on American Indian and Alaska Native people through education and improve access to prevention, early detection, treatment, and survivor support. So today's objectives of our webinar are going to include providing an overview of breast cancer rates in Indian country, highlighting survivorship and patient advocacy, discussing nutrition and food access, presenting Indigenous resources for our communities, and then highlighting the importance of breast cancer screenings. So ACAF is really excited to be celebrating our 6th annual Indigenous Pink event during October's National Breast Cancer Awareness Month. Indigenous Pink is a national campaign that raises awareness of breast cancer burdens in Indian country. Indigenous communities honor all people as sacred bodies, and this year ACAF's Indigenous Pink campaign highlights that all bodies have breast tissue and are at risk for developing breast cancer. So throughout the month of October, we share culturally appropriate resources to help educate Native people about the importance of early detection and screening, as well as honoring the strength of breast cancer survivors by sharing their stories. So we have some opportunities for clinics, community organizations, and community relatives to get involved. So this year, we encourage people to get involved by honoring our relatives by using inclusive language. So when sharing that everyone has breast tissue and anyone can get breast cancer, share resources and screening opportunities. Make sure you talk to people about getting screened, of course, and then participating on our Indigenous Pink Day, which is Thursday, October 15th. So on October 15th specifically, of course, continue to share those resources. And then if you wear pink, please take pictures and then use the hashtag Indigenous Pink or hashtag all bodies have breast tissue. So discussing breast cancer is important, or sorry, here, I forgot about our great calendar. So we have a lot of different opportunities for people to get involved. As you can see, we have our IP20 breast cancer symptoms checklist that you can take a look at. We also have a recipe book that on the 7th, which is today, we encourage you guys to make some of those. And then on the 15th, of course, is our Indigenous Pink Day. So I encourage you to find that on our website. So discussing breast cancer is important because we know that 1 in 8 women will get breast cancer in their lifetime. We currently don't have data on other Indigenous genders, which is a conversation about health equity. So for now, this conversation is going to focus on some of the data for our Native women. For Native women, breast cancer is the 2nd leading cause of cancer death. Someone is at an increased risk for breast cancer screening, or breast cancer, sorry, due to genetics, gender, breast density, family history, and age. So this list isn't exhaustive, and we know that many things like lack of access to screenings put a person at an increased risk. ACAF recommends that screening start around age 40. So there's a few things that you can do to reduce breast cancer. That includes getting regular mammograms, exercising, limiting alcohol use, and then doing those regular breast exams. So here we have one of our resources. It says check your dodo shaman, which means check your breasts in Ojibwe. And so one of the things that ACAF does is try to make sure that these are very culturally specific. As you can see, this is specific to Ojibwe tribes, but we also have a resource that is check your blank for other tribes to fill in with their tribal word for breasts. So in Indian country, our Indigenous women are diagnosed at younger ages and often in later stages. There is a 7% higher breast cancer rate compared to non-Hispanic white women and a 10% higher death rate. So research shows that in this particular study, from 1990 to 2009, it was shown that there has not been a decrease in mortality. And we also know that Native women have the lowest survival rate after 5 years of diagnosis at 63%. Another study that might be silver lining for some is that Native women report fewer symptoms in the long term. So again, with all of this research, I want to just emphasize that we don't have data on other genders, and we know that all bodies have breast tissue and are at varying risk levels for getting breast cancer. So now, to address some of the questions and ways to support cancer patients, Beth is going to be discussing survivorship.
Beth, I think you need to unmute.
There we go. Okay. There we go. Sorry about that. As Misha was saying, our survival rates are a huge disparity within the Native American population. And I want to just take a few minutes to identify who are our cancer survivors and how do we ensure that that continuum of care supports the person as a whole and also our communities. Cancer survivor, their journey begins at the date of diagnosis, and you are a survivor from that moment until you walk on, right? And you meet your creator for your next journey. And so in this continuum of care, we want to give you the tools to advocate for your physical well-being, your psychological well-being, your social well-being, and your spiritual well-being to ensure that you have a true quality of life. So under these physical well-beings, I just want to touch base on a couple of these things that impact our cancer survivors, not just after treatment, but maybe years later. And we want to give you the tools to be able to discuss these types of issues with your provider. So there are the functional status, and specifically with breast cancer, that can impact functional status mobility, and it can even creep into intimacy issues with your partners. And so be mindful of that. And we want to talk to you today about like being able to talk to your provider and asking questions and feeling comfortable with mentioning these things. From physical well-being, we also go over to the psychological well-being, which often survivors and many of you out there understand that there's control issues. You feel like a bit out of control, right? And there are anxiety issues, often depression. And these disparities that you're experiencing can be supported by your providers. And it's really important that you just find this comfortable place to discuss your well-being with your provider. The social well-beings include family distress, right? And that comes with financial issues, traveling for treatment, differences of appearance, right? And back again to that affection and sexual function that a lot of folks, we don't want to talk about that, right? But I encourage you all, as you make your journey as a survivor, to create this wonderful relationship with your provider. And at the same time, we encourage providers to create a comfortable, safe space for our survivors to talk to you. And last but not least is spiritual well-being. So culturally, there are different meanings of illnesses. And so it's important to include your provider and often ask for support from traditional healers and naturopathic healers to support your spiritual self, so that you do have this hope and you do gain this inner strength to make your journey in a safe space. Next, I would like to turn this back over to Misha so that we can move on with our discussion today.
Hi, everyone. I am back. So in this part of our webinar now, we are going to be doing more questions. And so hopefully you can see the panelist Q A section again that I have. It's hard to know with two different screens going on. Thank you for talking about survivorship, Beth. So again, as I stated, we're just going to be talking now about nutrition as it relates to our Indigenous diet, as well as our cancer patients. So throughout this webinar, it's really important that we highlight what it means or how we can take care of our cancer survivors, cancer patients in our communities. So to begin, Dr. Heiser, what are some things that patients should tell their doctor about their diet and lifestyle?
So I think in these kinds of questions, what providers are really trying to get at is basically to see if there are any drug interactions that could potentially go with other treatments that you may be getting, or any other kind of things that would put you at higher risk for certain complications. So I think a lot of people are sort of hesitant to be forthcoming with a lot of this information because they think they'll be stigmatized by things that they do at home, but really it's just to make sure that we're getting the patient to be in the safest places possible. So you should always have a list of the medications that you take regularly, whether it's prescribed versus non-prescribed. It could be supplements or alternative therapies that you're undertaking, whether it be traditional or other non-traditional type of medications. I would make a list of this and then provide it to your provider so that they can know exactly what you're taking and when you're taking it, because that will really help decrease your risk of other possible complications with the kind of treatments or things that they may be wanting to prescribe or treat you with.
Thank you. And then just to remind everyone that feel free to pop in wherever Beth or Sarah.
Oh, I was just gonna text Sarah to ask her to post a link. We have a link. We work with George Washington Cancer Center, and they have a wonderful patient checklist that patients can take with them to their appointments, which include all of their medicines, how they're feeling, and hitting those 4 areas of health and quality of life, so that you can think about it before you go and you don't feel that pressure when you get in the office and then you're like, I knew I didn't feel good when I came here, and it just all kind of fell out, right? So it's just a nice tool to keep with you with your notes and medicines as you travel to and from the doctor.
Great. Thank you for that resource. I think that kind of brings us nicely into the next question, which is how does utilizing a multidisciplinary approach support Indigenous values?
So I think it's very important. And I think that in order to provide patients with the best healthcare, it really does have to be a multidisciplinary approach, because what Beth was talking about was there are so many different aspects of your health that really need to be addressed with your care. And so that includes nutrition, talking to a dietitian, making sure that you're on quality caloric intake, meaning really your calories are not empty calories, basically, where would just be sugar and things like that, but had high nutritional quality to them. And then also talking about what Beth was saying was your physical well-being is part of it. So having physical therapists or occupational therapists a part of your treatment care, because afterwards having surgery or other kind of treatments can kind of alter your body. And it really helps to have providers who see this often and kind of help you work through those things. And then additionally, you have your oncologists, your surgeons, the physicians who all kind of make medical decisions and then can kind of relay all of this to the group. And then hopefully everybody is sort of talking to each other. And I think it reflects a Native American holistic view of the entire person and kind of approaching it from an entire well-being aspect instead of just looking at the medicine as one thing or the surgery as one thing, because this is all things that play into one patient and can really impact their outcome. So that includes spiritual, like if chaplains are there or other traditional healers to be involved to know kind of what they're also doing. I don't think it needs to be separate. I think it can be all one team working towards the same goal.
Yeah, I love that. I often, at least in the way that I was brought up, it generally looks like a web of interconnection. And so that's kind of how I see all of those points as a provider or a traditional healer kind of supporting the cancer survivor, cancer patient in the middle. So Our foods are medicines. How do traditional Indigenous foods, often referred to as the decolonization diet, support breast health and overall health?
So I think it is important to talk about what we mean by decolonized diet, because I think a lot of people, especially in the Southwest where I'm from on the Navajo Nation, a lot of people think that traditional foods include fry bread and things like that, which is actually part of the colonized diet because flour and sugar and coffee didn't come over until the settlers came over. So before that time, Indigenous people were actually more hunter-gatherers. So in that sense, their diets were naturally low in sugar, were not processed at all. So the calories they were taking were very nutritionally dense, meaning they had a lot of really good vitamins and minerals within the foods that they were getting, and they didn't need to take additional supplements. And what we do know from breast cancer specifically is that it's very estrogen dependent. So people who have high estrogen content, which is often in, well, which we know is in fat stores within the human body, can actually increase your risk of breast cancer. So if you're trying to decrease your fat or obesity, that will decrease your risk of feeding breast cancer cells. So I think it is important to talk about a decolonized diet as being the way to really try to get the nutrition that you need and help prevent breast cancer. And in all of that, it actually, everything, obesity is just a major comorbidity in and of itself, or can predispose you to a lot of other types of conditions, not just breast cancer. So I think it is important to think about the foods that you're getting in and think about quality more than quantity, because if you're eating a high sugar processed diet, that can really impact you in a lot of other ways, and specifically breast cancer itself because of the estrogen that drives the cancer.
So you talked a little bit about your tribe in the Southwest. What are some Indigenous or traditional foods to the area that you know of and that you like to eat?
So traditionally on the Navajo reservation, we're high desert. So we had traditionally a lot of wild sheep that we used as kind of our meat basis. And we still have that a lot of in our traditional diets now, which have kind of been skewed a little bit. But like most other Indigenous cultures, I think all of us kind of rely on the three sisters, which is the beans, the corn, and the squash. Those are all very nutritionally good quality things that are good to have in your diet. Other things that we had in the Southwest growing up are things like piñon. So it's all like things you would gather from the environment around you. And so those would be things here. I've learned a little bit more about Western New York as well. So there's always a little bit of berry stuff too. So in the Southwest, there's a sumac berry that we use to make some pudding. And then here in Western New York, they have, you know, rabbit and deer are around here usually is the protein basis. And then they have a lot of fish around. So the fish would also be part of the protein. And then part of that would also be the wild berries and some of the leaves here that they can all gather. So those would be kind of more traditional type foods. And I think in Minnesota, there's like wild rice and some other things that people would traditionally eat, which are good quality foods.
Yep, that's right. We have sumac here too. So it was really fun to hear some of the things that you listed. They're actually in our Indigenous Pink cookbook. And so a few recipes are around like the Odaman cedar tea or strawberry cedar tea, which includes the berries. And then also a berry sauce that the Lakota people call wojapi. Yeah, so that was fun to hear. So our next question is kind of shifting, or not quite shifting gears yet, but we are curious. We know from research that it's difficult, especially for Black, Indigenous, and people of color to voice their concerns about their health at the doctor's office. So what are your thoughts or advice for patients who are advocating for themselves and family in the healthcare system?
I think that is a very good point, and I've seen it play out myself throughout my training. So I've seen a variety of different people accessing care, and I feel like a lot of people who are Black, Indigenous, people of minority descent are usually not asking as many questions as people who are Caucasian. And I think there is some historical trauma related to that in terms of kind of feeling like you can't ask questions, or that's not your, you shouldn't put your head out there to get it chopped off kind of thing. But I really think it's in your best interest to try to think outside of that, and then realize that as providers, we're really wanting to do the best for you and treat you the best that we can. And in order to do that, we need to know some things about you, and you kind of need to be able to advocate for yourself in things that we may not be able to know. And so I think what Beth also was talking about earlier with the checklist, it's really important to kind of do your homework for more or less in terms of being prepared for your appointments, and kind of think ahead about what type of questions you may have. Make a list of them so that you don't forget them, and you can ask them when you're in the office with your provider or whoever you're seeing that day. And remember that it's okay to ask questions. We want you to ask questions. That's what we're here for. You're not an expert in this field. We are, so you should be asking all of the questions that you don't understand. If there's a word that doesn't make sense to you, you can ask us what that is and what it means. We want you to ask those things. And I think now in the digital age, it's even more helpful because there's a lot more access to, I think, resources and providers. And specifically, often people will have like an electronic portal where you can message your provider, and then the provider can get back to you at different points in time if you have other questions that come out outside of the appointment. And I think one thing that's been interesting in my training as well is that people who should be ashamed of something are never ashamed, and the people who have nothing to be ashamed about are always ashamed. So you can just remember that there's always somebody who has come in with something much worse than you, or like something you're afraid of, embarrassed of. Somebody has guaranteed had something way worse than you, and they were probably not embarrassed about it. So you can always think about that if you're kind of embarrassed or ashamed about something. And then lastly, I think it's important for you to let your provider know what your goals of care are. Like, what do you want to get out of the care? If you really don't want to have chemotherapy or some drastic treatment, and you just want to optimize your quality of life, then that is something that we should know, and it will change the way we approach different things. And if you're scared of certain aspects of the treatment, you should let us know that too, so that we can try to explain that more to you.
Dr. Heiser, I have one question. Do you think it's helpful if patients bring in family members or a friend with them?
I do. I think it's a good idea, because I think often it's so much information, it's so overwhelming for patients. It's going to be so hard for you to remember everything that you talked about in your appointment, and you're going to be flustered, and there's going to be a lot of other things. So it'll be nice if you have somebody else with you who can listen, and then also ask questions if there's something that they don't understand that may help you too. So I think it is a very good idea to bring in other people.
Thank you.
I know sometimes some of our community members like to have traditional healers present. So what are some ways that healthcare staff can empower Indigenous cancer patients with their cultural beliefs, including the value of the family, community, and traditional healers?
I think it is really important for providers to get to know the traditional healers that are within their communities, and the people that, the elders who would be kind of the people who would help these people get through, the community or the cancer diagnosis, kind of help support them. Because I think, going back to what I said before, this holistic multidisciplinary approach, I think it's important to have that support from other healers. And I don't think that those are two separate things. Traditional and Western medicine can be done at the same time. I think that they just have to be upfront about who's doing what at what point, because sometimes there can be side effects to each of them. So I think it needs to be kind of timed in a certain way, but I don't think that they need to be exclusive. I think it is also important for providers to ask patients and take the onus of themselves to see if their patients would like more traditional healers or any kind of additional therapeutic support that they may think that they may want or may not want, just to ask the question, because the patient may not even know that that could be done. And then I think it is also important for providers to be asking their patients what their goals are to get out of this treatment and to see if that is realistic or not realistic. That way everybody's kind of on the same page. And then also to make sure that you are asking also about patient fears about the process and make sure that they're available, and like just seeing them in the clinic or wherever you are is not sort of the end all. This is kind of a journey that you're all taking together. And I think it's important to keep those lines of communication open.
So I know that Beth does some facilitation of conversations about some of these topics actually. So I'd be curious, Beth, do you have anything to add?
So I agree with Dr. Heiser, hit everything that I discuss with providers, and that also that we encourage with patients. We have developed toolkits and binders for patients to carry with them, right? So that they have phone number list of their local primary care and community resources. They have all the phone numbers of their doctors at their cancer treatment centers and their primary care centers, so that when they do present at their provider's office, if there are questions, they have information available to them right away. And a big push that we're doing with our providers is making sure that they treat the patients in an integrative care model, just as the tribal health centers are optimally set up with, dental and primary care and behavioral health and vision support and the traditional healers. We want them to not lose sight of that and take advantage of these and refer the patients over, right? So that not just while they're at the cancer center meeting with oncologists, but also when they return to that primary care setting.
Thank you. I think this advice is all really insightful for me as someone who helps take care of my loved ones. We do have one last question for Dr. Heiser, but I know that we're going to address it at the end too. So I guess we'll address it here and then at the end as well. So one of our questions is, why is it important to continue screenings? And what would you tell a patient who is afraid of going to their screening appointment because of COVID-19?
So I think kind of what was talked about before with Misha, the screening guidelines of when to start breast screening. I think that's there is a caveat with that. If you have a family history of breast cancer, your screening age may be even lower than the 40 years old. So I think that it's important to tell your provider of any family history of either breast, colorectal, ovarian kind of cancers specifically, but any cancers in general, because sometimes there are genetic syndromes that can predispose people to cancer. And so what the screening actually does is try to catch cancer at its most treatable stage. So if you are able to get a mammogram, which is the screening method of choice for breast cancer, if you get these regularly as scheduled, then you're more likely to be able to catch early breast cancers and make it very treatable. It makes it very hard to be able to treat a cancer that is diagnosed in a late stage, which Misha talked about before, and most Native Americans do present at later stages, and usually it's because they have not gone in for screening to catch it early enough. And so that by that point in time, the treatment options are a little more limited in terms of what we can do to treat the breast cancer, and it may not even be completely treatable. So what the breast cancer screening really does is try to get it, it doesn't prevent you from getting breast cancer, but it does catch it at an early stage if you are to develop breast cancer and be able to treat it, and it can become curable if it is treated or if it's caught early enough. So I think that's the really important thing to stress about screening. The other thing is, I think that especially now with COVID, I can understand why people are scared to go to medical providers because they think that they'll be even more exposed to COVID. But I think that is actually not true. I think because most hospitals and clinics have done things to kind of prevent the spread of COVID within the clinics and hospitals. So I don't think that you should take that into consideration as a reason not to get screening, because usually in people who get treatment or need to have extended stays at the hospital, they get COVID tested when they come to the hospital. Everybody wears a mask, everybody gets temperature screened before they come into the hospital or clinic. So I think that you are putting yourself at increased risk of any kind of cancer screening process or getting at an early enough stage to treat it by not coming in due to COVID concerns. And I think those are valid concerns, but I think we're doing things to address them to help prevent that. So I don't think that should be something that should influence your decision.
I have something to add to that. The tribal health centers across the United States have, they're really accommodating women and men because of this COVID pandemic. And you don't have to go to your tribal health center just to make an appointment to get a cancer screening. You can call your primary care provider, whether you use tribal health or insured health across the United States, and they will just set you up with a referral so that you're only making one trip to the doctor to get your screening. So you don't have to go to your primary care and take time off work or spend time or feel exposed there and then take another time for your screening. They will do a referral for you over the phone, just a short discussion with either the receptionist or nurse or provider. And so that will facilitate less time away for you and keep you where you feel safe.
Yeah, thank you. Thank you both. So right now I'm going to turn it over to Sarah and Beth to discuss food access. And then before we start with that, just a reminder that you can type your questions in the chat and we'll answer those throughout or at the end.
Yeah, thank you for that discussion. That was great. Kind of going back to that self-advocacy piece. Beth, I want to ask you, like, what are your thoughts or advice for cancer patients who are advocating for themselves and family for access to nutritious foods?
So again, it's if you're in tribal health centers, most of the primary care providers in the tribal health centers have direct access to dietitians, nutritionists, and local food support facilities. And so again, all you have to do is ask, right? Just say, I need a little bit of help. I'm not sure, what I should be eating. The doctors at my cancer treatment center told me that I should eat this. And as soon as they know that the need is there, they can provide a referral at no cost to you. For folks that are being seen in urban areas or at their cancer treatment centers, most of you will have a patient navigator. And even if you've completed treatment, you can call them back and say, I still need a little more support. And, you don't have to say a lot of words. You just need to say, I need a little help with, I'm not sure what to eat, or I'm not sure how to deal. Maybe I'm trying to lose weight. They told me I shouldn't eat sugar, and they just don't know what those foods are. So the dietitians and nutritionists are there to explain all this for you.
Yeah. I like that you hit on the fact that there's a lot of nutrition information out there. And I know you and I talk a lot about healthy eating at work, and I wanted to ask you, what are some ways that healthy eating can be less expensive and even incorporate traditional foods?
So as Dr. Heiser talked about, decolonizing your diet, getting back to food at its origin and not in a bottle in a fast food area. Like I personally live and we teach across the state of Michigan is eating seasonally, right? So eating seasonally, the food is available and often less expensive, right? Foraging seasonally for those who use traditional foods and traditional medicines, you know, look at the calendars, watch the weather, understand and reach out, right, within your community to learn how to get back to these this decolonization way of living, right? And to eat seasonally and forage for what you can, because not only foraging are you getting food at its origin, but it's also a form of exercise. So we really like to talk about that. Eating seasonally, if you have extra foods, you can freeze it. And freezing, you can keep the food for up to a year, sometimes longer, right? So if you find a large quantity of berries, they can be, you know, just put on cookie sheets and frozen and put in bags. You can freeze squash frozen. You can freeze squash after it's been cooked. And so there's ways to store. This season here in Michigan right now, apples are bountiful, right? And so you can cook them and can them and freeze them. And so it's just kind of using your intuition, like what pleases you and what is nutritious and good for you that you want to eat later, and just kind of, you know, and then also buying as a family, right? Maybe you have aunties or your other elders that, you know, also need support and want to find a more less expensive way to eat. So buying in bulk, right? And talking to your family members and cooking as a family and canning as a family and preserving.
Yeah, that's great. I like that you focused on just doing simple things as a household too. We know that healthy eating takes place in the family, and healthy eating doesn't mean whatever is trendy online. So thank you. Can you talk about what kinds of food access programs that are available to either cancer survivors or just general community members who need assistance?
So there are a number of programs, and this is really come to light and often really needed now as we endure the COVID-19 pandemic, right? And then also we have these survivors that we're trying to support, right? And so income goes down, right, as you are less employed. And then often income goes down as you are tasked more to go to the doctor for your cancer treatment and as you endure your journey there. The federal government has a few programs that have really been improved. They have the Supplemental Nutrition Assistance Program, and I think Sarah's going to post that link in our chat, and that's the SNAP program. I know in Michigan, they call it the Bridge program. Under SNAP, there's a second program called Double Up Food Bucks, and I don't know if anyone's heard of that. Double Up Food Bucks is a food dollar matching program. Double Up Food Bucks matches dollar for dollar. So if you use your SNAP benefits to buy fresh fruits and vegetables, for every dollar you spend during a day, in one day, you get $1 back. So I know in Michigan, it was up to $20 a day. And I know in some states they've waived this because of the pandemic. So if you buy $20 worth of fresh fruits and vegetables on Monday, on Tuesday, you will have another $20 in your SNAP card, which is like an EBT, to buy more fresh fruits and vegetables. And that it just continues throughout the month. So you spend $20 on Monday, you'll have $20 more on Tuesday to buy more fresh fruits and vegetables. And that is an amazing program. And we have that link on our chat. And so I encourage everyone to take a look at that. If you live in a tribal community, there's the Food Distribution on Indian Reservations program, which was formerly and probably still known as a slang as commodities. And traditionally, commodities was not a good thing, right? It kind of fed some of our health disparities. But now the food distribution program on Indian reservations, with input from tribal communities across the United States, this program now has salmon available, bison, lean, healthy meats, fresh frozen fruits and vegetables. They're reducing the juices and kind of making food available to you in a form that is not going to be toxic to your system. And then most importantly for anyone, regardless of income, are food pantries. Now, you may have a great job, but there are some months where if you just can't make it, or if you're undergoing cancer treatment and your funds are low from traveling and buying medicines and just kind of taking care of needs, local food pantries do not ask what your income is, right? And I know almost every food pantry has either a dietitian or a nutritionist supporting them so that they can provide the right foods for you. And I know in Michigan, Minnesota, the farmers provide their excess fruits and vegetables to these pantries. So going into a pantry does not mean that you're going to pick up a box of powdered cheese and some noodles. I mean, there's actually fresh root vegetables and kale and tomatoes and beans throughout the year. So these are just a few of the options. We have posted the links so that you can look up food pantries in your area. You can find out who your contact is for the food distribution program on your tribal reservation. And then of course, SNAP and Double Up Food Bucks.
Yeah, these are a lot of great resources. Like we said, they're all in the chat. I know it's a lot. We also posted the Indigenous Pink recipe book. I'll share these as well on our social medias. If your organization wants to share it on your social media, I'm sure that would be a great help to someone. So thank you.
Yes, definitely. We can share those. Thank you so much for posting those. I know I myself have learned a lot about nutrition from you in just this short while. So thank you for the opportunity. So the last thing that we are going to address is cancer screenings again, because we know that many people are feeling very wary of this, as we kind of mentioned. And so we just kind of want to drive home that it's really important to make sure that we're talking to everyone about this, whether or not it's from the healthcare provider standpoint to the patient, or if it's just as a concerned loved one. So I guess my question now is going to open it up to both Beth and Sarah, and of course, Dr. Heiser as well, to talk about ways you would encourage your loved ones to get screened right now.
Well, one of the resources that Intertribal Council has is our Quay Brave social media pages. So I'll go ahead and share what that is about. I'll share my screen. So Quay Brave is our network of breast cancer survivors and Indigenous women. We call this Quay Brave because in Ojibwe, Quay means woman. This represents the community of Indigenous breast cancer survivors, as well as anyone who advocates for better health and awareness for Native Americans. The Intertribal Council started this project with the Young Breast Cancer Survivors Grant, noticing the gaps that Misha had talked about previously with the awareness in breast cancer and support specifically for young breast cancers, because they're young breast cancer survivors, because there aren't many resources and outreach targeting them. And we actually have a national audience of all ages. So it's really cool to see the value in sharing our stories across generations. So as you can see, this is an online platform on social media. And these are some of the examples of things that we are sharing. And in the top left corner, we have an example of our poster that encourages women to do self-breast exams. And this poster is actually being printed and placed in women's restrooms in casinos throughout the state of Michigan to promote breast health. And this is really about knowing how your breasts look and normally feel. Quite Brave is really a place to learn and advocate. Maybe you had a family member with cancer and you want to know how to support them, or what lifestyle factors, like we had talked about here, that influence your cancer risk. And we do talk about, like we had said before, with family history being so important, but it is really hard sometimes to talk to your family about cancer and how to ask them. So we share some advice on that. So our goal really is to provide you with the information that you need to make decisions about your health as women. And then I also wanted to share a quote. This is from our mobile mammography unit that we did in Hannibal Indian community a couple weeks ago. So Amanda completed her yearly mammogram and she wants everyone to know, she says, "I think it's important to get these screenings done, and I hope more girls realize that once you get older, you need to be aware of your body and getting things checked for your health." We just want to encourage women to get screened and know your body so that you can notice changes and abnormalities, and to feel empowered to reach out to your doctor if you feel like something might be off. Cancer doesn't quarantine, so it's even more important in this pandemic to advocate for yourself and for your health. So that this platform is for Indigenous women, and we recognize like the power of the Indigenous Pink community and having support from other women to feel like you're not alone in this journey. And actually, if anyone would like to share their story of being a young breast cancer survivor, please reach out to us on Quay Brave. I'll post our links to our social medias, and we would love to hear your story and share it with everyone.
Misha, I would like to just, on the subject of mammogram events, if you see a pink van that is doing mammograms, go up and just tell them, and you're 40 years old, just go up and tell them you'd like to be screened. These mammogram events are very popular. They're all over the United States, and there's no appointment required. And as Sarah can attest, we enrolled women who were uninsured on the spot and got them screened. Each state across the United States has breast cancer screening programs that support uninsured women or underinsured women. So we know often there's a $500 copay for some cancer screenings, and these programs waive those copays. And so, and if by chance you need additional screening referrals, these programs will support you in further diagnostic care, and of course, if needed, enrollment in Medicaid or other health programs. So don't be afraid to step out and ask to be screened, because as Dr. Heiser said, if by chance you are find something wrong, it's early to find it early. It's better to find it early than wait. And so we don't want those late stage diagnoses. So just step up and ask if there are free screening programs, because they're out there.
Yeah, that's really great. Thank you for sharing some of those resources. I know I myself would probably just encourage, as Sarah had said, cancer doesn't quarantine. And so continue to get those screenings, because we know that many of these health issues don't go away just because we are isolating ourselves, or many of us are at least. So we are getting close to time. I want to open it up to the audience to type in their questions into the chat box. And then if Dr. Heiser, Beth, or Sarah have any final remarks, I'd love to hear those too as we get some of those questions in.
I think the only other thing I would add is that this is a scary topic, and I think it's normal for people to feel scared and kind of everyone's like, I don't want to get a mammogram because I don't want them to find cancer. But I mean, that's why we do mammograms, to find cancer and make sure that it's an early thing or in early stages where we can treat it. So just because we're not finding it doesn't mean that you don't have cancer because you didn't get a mammogram. It just makes it harder to treat if you wait longer. So I think it's really just changing the mindset. And I think these feelings of fear are normal. You're not the first person to feel that way. And I think that you will find lots of other people in your community who've probably experienced some of the same things. So this is not something that needs to be shunned or quieted or something that's taboo to talk about, because guaranteed there are multiple people in your community who have experienced the same thing.
And as Dr. Heiser mentioned earlier, we also do a lot of work of knowing your family history. So talk to your elders, talk to your aunties, your moms, your cousins, and ask them about your family health history so that you know when it's the right time to bring it up with your provider. So if you're 28 and you know that, you know, maybe your mom's sister had cancer, or your dad's sister, or your dad's brother, these are all important things for you to bring to your doctor and just tell them so that they know when it's the right time for you to get screened.
So I guess we do have kind of one question. It is, would you share the link for the patient checklist?
Oh, yeah, sure. Sarah's going to put that right up. Yeah.
Great,
That's
thank you.
on the George Washington Cancer Center survivorship page, if anyone wants to just Google it too.
And I know, so as Beth had kind of mentioned, they have opportunities for screening there. I know that here at ACAF, we also have some opportunities for community members to get screened. I would encourage you to go to our website and find out which programs we're partnering with to provide those to Indigenous communities. I know off the top of my head, I can speak to working with South Dakota Urban Indian Health Clinic, and then the Native American Community Clinic here in Minneapolis, as well as a few others across the country. So yeah. Thank you all so much for being a part of our webinar today. Doesn't look like we have any questions right now. But if we do have any questions after this, I'm sure all of us would be open to being contacted by others so that we can answer and address some of the questions that you have. Yep, and I will follow up in an email with some of the links that we have here. And if you have any questions, yeah, just please feel free to reach out. Thank you, Beth, Sarah, and Dr. Heiser so much for joining us for our Indigenous Pink webinar.
Thank you, Michelle.
Thank you, Misha.
Thank you.
Thank you, Dr. Heiser.
Thank you all. Have a great day.
Thank you.
You too.
Bye.
Bye.